Thank you all for joining us this morning for our March 2022 Community Breakfast. My name is Karen King. I'm the Community Affairs Liaison for the Office of New Haven Affairs. Our office hosts these community breakfasts on the first Thursday of the month during the academic year. And each breakfast features one or more members of the Yale community to talk about their areas of expertise or to share with you resources that are available for you to take advantage of, participate in, etc. I have a few announcements before we get started. The first is the Yale African American Affinity Group is hosting a number of wonderful events in honor of Women's History Month and beyond. But for this month in particular, they're holding various celebrations, workshops, book discussions, screenings. So I will put this information in the chat so that you can check out their calendar and register. The Yale-New Haven Hiring Initiative is charged with hiring New Haven residents for jobs at Yale University. Chris Brown, you will see is on your screen. Chris Brown is the director of the New Haven Hiring Initiative. He and his mighty team, small but mighty team, are always on the lookout for trying to get the word out about jobs that are available at New Haven, at Yale University for New Haven residents. I will share a link to their latest newsletter so that you can get some additional information. This month, they are highlighting positions that are open for medical assistants and administrative assistants. So please check out the newsletter and then reach out to Chris and his team if you have any questions. And great news, if you are a sports fan, Yale University recently announced that fans are able to come to games. They are asking that people wear Yale approved masks and that you are vaccinated, so you have to provide proof of vaccination and your ID, and youth between the ages of 5 and 11 had to provide proof of an up-to-date vaccination. I recently learned that of the 32 teams, sports teams at Yale has 27 of those teams host games for free. And so I encourage you to check out this link and further explore the sports calendar for exciting opportunities for you to go out and maybe learn about a new sport, expose your local youth to a new sport, and also be able to meet these outstanding athletes and students up close and personal. So, as I mentioned, we have wonderful speakers every month. We have a full slate of speakers this month for, I think, a very important topic. You will see 4 fantastic speakers on the screen. First I would like to introduce Rachel Forman. She's an assistant professor at the Yale School of Medicine and a stroke neurologist at Yale-New Haven Hospital. Rachel completed her medical school education and neurology residency training in Chicago at Chicago Medical School and Rush University Medical Center, and completed her stroke fellowship at Massachusetts General Hospital in 2019. Since medical school, she's been passionate about community stroke education, focusing on underserved areas, and she has created stroke outreach groups in Chicago and Boston, and more recently partnered with the Yale Stamp Out Stroke program to continue these efforts. Her areas of interest include community stroke education and interventions, childhood stroke education, and addressing racial and ethnic disparities in stroke care. Next is Ranisha Parker. Ranisha received her Bachelor of Science in Nursing from the University of St. Joseph and Master of Science in Nursing with a concentration in Public Health Nursing from the University of Hartford. She has worked as a registered nurse for the Yale-New Haven Health System since 2015, working at the bedside on a medical surgical unit and then the surgical intensive care unit before joining the Yale Stroke Center as a stroke nurse navigator. In 2020, Ranisha transitioned into the novel and innovative role of Outreach and Integration Coordinator for the Yale Stroke Center, where she continually works to improve patient and system-related outcomes for stroke patients by educating EMS, bridging partnerships with local stroke programs, and promoting stroke awareness in the community. Next is Smiksha. Chopra is a first-year MD, PhD candidate at the Yale School of Medicine. otherwise known as YSM. She previously graduated from UCLA in 2019 with a bachelor's in neuroscience and a minor in art history. Her engagements include treasurer for Stamp Out Stroke, treasurer of the YSM Medical Student Council, co-leader of the South American Medically Oriented Student Association, and co-leader of U.S. Health Justice Elective. She hopes to continue pursuing a career in neuroscience research, as well as leaving a meaningful impact in the communities around her. And we have Gwyneth Maloy. Gwyneth is a first-year MD candidate at the Yale School of Medicine, who grew up in New Haven, Connecticut. She graduated from Williams College in 2021 with a bachelor's in biology and psychology with a concentration in neuroscience. At the Yale School of Medicine, she is a secretary of the Stamp Out Stroke program. She is interested in brain health, medical education, and community engagement. Please help me welcome our speakers, and I'll hand it off to Rachel. Welcome, Rachel.
Thank you. Thank you so much, Karen, for inviting us today and for having us. And thank you all for coming. We're going to be talking today about stroke, and I wanted to also introduce you to our program called Stamp Out Stroke. Go to the next slide. So the Yale Stamp Out Stroke program has been in existence for a while, and more recently we've become more active. We've actually stayed pretty active despite COVID-19, and we did 11 events last year in 2021. Our group, our mission is simple. We want to educate our community about stroke. As you'll see soon, stroke is a preventable disease, and there's a lot of important information to get out there because it can be life-saving information. If you like what you hear today and can think of any areas in the community that would want to have a similar lecture, we are very open and excited to give this information to any groups. We have about 5 events scheduled in the next few months at churches, senior centers. We're going to the Hindu Cultural Center. So please reach out to us. You can email this email or reach out to me, Ranisha, directly, and then feel free to follow us on social media. All right, so just a general disclosure that the information we talk about today is going to be general stroke information. We can't address anyone's individual health questions, but there will be a period at the end where we can do a Q&A session. So first, we're going to talk about your brain. So, and I'm acknowledging that I'm sure there's a level of knowledge between the different individuals here today, but we just want to keep this very basic for everybody. So the brain is the main control center. It controls everything we do. It controls how we think, move, see, speak. And the way this is fueled is by nutrient-rich oxygenated blood that goes up to our brain. And there are 4 main arteries that bring blood up there. There's 2 in the front called our carotid arteries and 2 in the back called our vertebral arteries. And this blood travels through those 4 main arteries and supplies all of our brain tissue. So what is a stroke? The main type of stroke that happens is called an ischemic stroke. And when you think about the word stroke, that's probably the type you're thinking about, where there's a blood clot that goes up to the brain. Similar that you can have a blood clot in other parts of your body. So what happens is there's a blockage, and you can see on the screen here that you have these main arteries that are carrying blood up, and then there's occlusion or a blockage there. And when you see in that zoomed in photo, there's a clot, and that's preventing blood from traveling all the way out to those periphery areas of the brain. And it happens very suddenly. So, you know, you're going about your day, and then there's a clot that happens, and all of a sudden, all of that tissue is essentially starting to die off because it's not getting oxygen and blood. And just so you know, there is also a type of stroke called a hemorrhagic or a bleeding stroke, and that is a less common type, but it also is very devastating. And that what happens there is the blood vessel actually breaks open. You get similar symptoms because that blood is putting pressure on the brain, and it's also going to cause symptoms to happen. So stroke is very significant in this country and worldwide. Every 40 seconds, someone suffers a stroke. One of the big take-home messages for today is that 80%, if not more, are preventable, which means if you talk to your healthcare provider about your stroke risk, you can start tackling any of your risk factors that you have. And a lot of the times, which is really sad, people just don't know they have these risk factors, so they don't even know that they need to be doing anything about it. Stroke is also the number 5 leading cause of death in this country, and it's the number 1 cause of disability. So please talk to your healthcare provider about your stroke risk.
Okay, so now we're going to talk about some of those more specific risk factors that Dr. Forman mentioned. So to start, there are some non-modifiable risk factors, so things we cannot change that may contribute to your risk of a stroke. Older individuals are more at risk of stroke. Women are known to have more strokes than men. And then also people with a family history of stroke. So this is definitely something to bring up to your healthcare provider, even if it's something you might not be able to change directly. It's definitely something to talk about and consider when estimating your stroke risk. So we're going to focus on the modifiable risk factors that you can address with your healthcare provider. And the number one risk factor that we want to talk about today is high blood pressure. And we'll go into this a little bit more on the next few slides, but just keep that in mind. Smoking is also a really important risk factor when thinking about stroke. And oftentimes when you talk about the negative effects of smoking, you might think about the effects on your lungs and something like lung cancer, but it's also a really important risk factor in cardiovascular events, including stroke. Physical inactivity and obesity. So if you're more physically inactive, you're at a higher risk. That goes hand in hand with obesity, defined as a BMI of 30 or higher, and high cholesterol, which some factors may be genetic, but oftentimes also impacted by our diets and can be managed with different medications and lifestyle changes. Diabetes, atrial fibrillation, which is an issue where your heart rhythm is beating a little bit incorrectly, and sleep apnea are all modifiable risk factors that you can address with your healthcare provider, your primary care provider, in your annual checkup. So you don't have to go to any specialist initially. You can just talk to your primary care provider about these issues, and these are all modifiable risk factors. So what is high blood pressure and why is it so devastating? So to start with the basics, blood pressure is the force of blood against the walls of your arteries. And you might have noticed there are two numbers here on the image on the right, 120/80. This is generally our goal for a blood pressure, but the systolic pressure is the force of the blood against the walls of the vessels when the heart contracts. And this is going to be the higher number that you see here. Diastolic pressure is going to be the force of the blood against the walls of the vessels when the heart is at rest and refilling. So this number is going to be a little bit lower. And typically, if one number is high, the other number is going to be high, but it really depends on the exact cause of your blood pressure being high. And in a medical setting, you might hear high blood pressure being referred to as hypertension. These words are synonymous. And the issue with hypertension is that if blood is flowing with too much force or pressure on the arteries, this can cause them to stretch past their healthy limit and put a lot of strain on the arteries, because again, your heart is pumping every single minute, every single day that you are alive. So this can over time lead to small tears and scarring in the arteries. So parts of the arteries will be weakened and other parts will be scarred over and thickened. And this is going to lead to suboptimal performance in your blood vessels. And the real concern here is blockages, clots, and then these hardened and weakened arteries. So you may have heard high blood pressure referred to as the silent killer, and this is because many people are actually unaware that they have high blood pressure. And if you see the chart on the right gives you a sense of what normal, elevated, and high blood pressure is defined as. And this is something you can talk about again with your healthcare provider, definitely not something to memorize here. But just know that high blood pressure over time increases your risk of stroke, heart attack, kidney failure, and heart failure. So this is why it's important to get your blood pressure checked regularly. And if you are diagnosed with high blood pressure, you can have a conversation about ways to monitor this at home, conversations about any medications that you're taking. Medications can contribute to high blood pressure, but there are also medications that can help you manage and lower your blood pressure. And then any barriers that you face when managing your blood pressure, because although we mentioned a long list of modifiable risk factors, we do recognize that these are not always the easiest things to change, and they might not change overnight. So it's important to have an honest conversation about the efforts that you can make and where you're facing challenges. Just to summarize, high blood pressure is something that can be checked, lowered, and controlled, and this will significantly decrease your risk of having a stroke in the future. And then here we just have a video about cholesterol. I don't know if Ranisha, you can play it.
Is the video supposed to have sound? This is not coming through on my end. I thought it was just me.
Is this better?
That is.
Better?
Cholesterol. It's essential to your well-being. But what do you really know about it? Let's start with the basics. What exactly is cholesterol? Well, it's a waxy, fat-like substance that's made in your liver and travels throughout your bloodstream. It's a key ingredient that your body needs to make new cells. But too much cholesterol can lead to serious problems, such as heart disease and stroke. Here's why. You see, there are actually two main types of cholesterol, LDL and HDL. LDL, or low-density lipoprotein, is sometimes called bad cholesterol because it can build up inside your arteries, which causes them to narrow, which can lead to heart disease or stroke. That's why you should try to keep your LDL low. Think of it this way. The L in LDL is for lower or lousy. On the other hand, HDL, or high-density lipoprotein, is the good kind of cholesterol. It carries LDL, the bad stuff, away from your arteries and back to your liver, where it's broken down and processed by your body. That's why you want your HDL to be higher. In this case, the H in HDL is for higher or healthy. There's actually a third component known as triglycerides, which plays a role in your cholesterol health. Triglycerides are the most common type of fat in your body, and their job is to store excess fat from your diet. Elevated triglycerides, along with low HDL and high LDL, can also increase your risk for cardiovascular disease, so it's important to keep your triglyceride levels low. For anyone who's had their cholesterol checked, it's only natural to focus on your cholesterol score or the actual numbers. But the numbers don't really tell the whole story about your health. That's why it's important to discuss all of your risk factors with your healthcare provider, including risk factors that you can change, like eating a healthy diet, getting plenty of physical activity, and quitting smoking. Controlling your cholesterol may be easier than you think, but it all starts with getting your cholesterol checked. It's a quick and easy test. So if you're due to have your levels checked, or if you never had them checked, make it a priority. Taking the next step in managing your health is as easy as CCC. Check, change, and control your cholesterol. Get started now by visiting heart.org/cholesterol.
Thank you, Gwyneth, for that awesome transition. And next modifiable risk factor that we would like to discuss is smoking. So while smoking rates have decreased in the US over the last few decades, 20% of US adults still smoke and are at higher risk of stroke. The effects of smoking on the blood and vascular system are some of what we've discussed already. One is that they raise triglycerides, which we just saw as a bad type of fat that's stored in your blood. There's the ability for smoking to lower good cholesterol, so that's our healthy or high density lipoproteins. There's also the fact that smoking can make your blood sticky and more likely to clot, which can block blood flow to the heart and brain. And smoking has also been shown to cause thickening and narrowing of blood vessels. So it's not just firsthand smoking that can do this, but even secondhand smoking can increase your risk of stroke. Breathing in secondhand smoke briefly can pitch the line of blood vessels and still make your blood sticky and more likely to clot. So when you're smoking, you're not only impacting your own health, but the health of the people around you as well. Next slide, please. Thank you. And so what are the few benefits that we have for quitting? And it's a little more than a few. One is that inflammation will go down and your blood vessels start to heal over time. And as early as just 2 to 12 weeks, circulation of your blood improves. Within a year, the risk of heart attack and stroke is cut in half. And within 4 to 5 years, a former smoker's risk of stroke is almost identical to that of a lifetime non-smoker. So the main message is that quitting smoking can decrease your risk of stroke. And so if you're thinking about quitting smoking, your healthcare provider is a great first resource to use. And there are multiple resources that are available online as well that we can discuss afterwards if you're looking at quitting smoking. And so what else can we do to lower our risk of stroke? There's a heart healthy diet that we can promote. Again, your healthcare provider can kind of set up a system with you if you're looking to pursue a heart healthy diet. You want to increase your physical activity. As we mentioned, quitting smoking would help. And you also want to make sure you do regular visits with your healthcare provider. And this is so that you can basically talk to them about your blood sugar levels, your blood pressure levels, cholesterol, and any family history of stroke. So there's a great first resource for figuring out what are your non-modifiable risk factors and your modifiable risk factors, and what can you do to integrate that into your day-to-day lifestyle. And so there's a couple different things that are co-associated with stroke. So we covered a few already: high cholesterol, we mentioned sleep apnea, high blood pressure, smoking. But in general, heart disease, diabetes, and physical inactivity all are risk factors that are known as comorbidities, or diseases that occur oftentimes with stroke. But there's one that we haven't mentioned yet. And the one that we haven't mentioned are basically what are your psychosocial risk factors. And so your psychosocial risk factors are factors that impact your mental health and your emotional health. And so there are many psychological and social risk factors that can increase a person's risk for stroke. And these can include anything from stress to depression, anxiety, PTSD, and even social isolation and loneliness. But they're modifiable still, and there's things that you can do to impact these more psychological and social factors. So the first thing you can do is promote healthy lifestyle behaviors. So these are things like mindfulness activities, getting out, getting active, and basically just moving into an outside space as a way to promote a healthier lifestyle. You can also engage in healthier social behaviors, such as spending time with family and friends. You'll want to participate in extracurricular activities, basically things that take your mind off of work and stress. Engaging in enjoyable social activities and hobbies will also help. And again, always, always, always ask for help. Talking to someone is one of the best ways to kind of move in this direction of addressing some of the more psychological and social factors, whether that's with a trusted adult, a healthcare provider, just anyone that you can talk to and seek help from. And on that note, I'm going to pass the mic to Ranisha to tell you about how to tell if you're having a stroke or someone else around you is having a stroke.
Thanks. So we've already focused on how to prevent stroke, but now we're going to switch gears a little bit and talk about how do you recognize if someone's having a stroke, and then what are the treatment options. So for recognizing if someone's having a stroke, we use the BFAST acronym. And this helps us remember symptoms that might suggest that a person is having a stroke. And for all of these symptoms, it's going to be, they all happen suddenly. So I just want to point out that these are sudden onset of the symptoms we're going to go through. So B is for balance. And the question you can ask is, does the person have a sudden loss of balance or unsteady gait? Are they walking funny, leaning towards one side when they walk? E is for eyes, and that's, does the person have loss of vision or sudden change in vision in one eye or both eyes. F is for face. And for that, we're asking, does the person's face suddenly look uneven? Do they have, some people might have heard of facial droop. So do they have one side of their face that looks like it's droopy compared to the other side? And then A is for arms, but we're also going to talk about legs as well. And so we're asking, does a person have one side of their body, their arm and or their leg that's weak or numb? Are they dragging their leg? Are they unable to lift their arm, suddenly unable to pick up a remote or their cell phone? And then S is for speech. And a question we would ask is the person having sudden slurred speech? Or do they have difficulty speaking? Are they having a hard time getting the words to come out? And then also, do they seem confused? Are they talking and what they say, it sounds clear, but it does not make sense? And if they have any of these symptoms, T is for time. And we want to call 911 right away, because any of these symptoms can be a sign that a person's having a stroke. And we want to emphasize that it does not need to be all of these symptoms. It can be one or a couple of these symptoms, but recognition of any of these, call 911 right away. And then Dr. Forman had mentioned that there's another type of stroke called a hemorrhagic stroke, the bleeding type stroke. And for that, we also want to look out for worst headache of their life or thunderclap headache. And if someone suddenly has that, they should call 911 as well. So once you recognize these symptoms where you want to call 911 right away, the faster a person gets to a hospital and is evaluated by a stroke team or neurologist, they have a better likelihood of suffering less likely of suffering devastating consequences and recovering well from their stroke. So we want to make sure that we're calling 911 right away. Time is brain. And what this means is that roughly 2 million brain cells die in the event of a stroke every minute while we're waiting for treatment. So the sooner we call 911, the sooner we're evaluated and able to hopefully have the treatments available that will help to decrease the severity of the stroke. So don't delay, call 911 right away. When a patient comes to the hospital, and they're having symptoms of a stroke, there are two treatment options. They are both time sensitive, which is also why we want to make sure we're calling 911 right away. One of the treatment options is something called tissue plasminogen activator, or TPA, or alteplase. And what this is a clot busting medication that is given through IV that helps dissolve the clot and restore blood flow. But this medication can only be given within 3 to 4.5 hours of the start of symptoms. So if a person has symptoms that start at 8 a.m., they have until 11 to 12:30 to get to the hospital and receive this treatment. It's very time sensitive. The other treatment option is mechanical thrombectomy. And for this, it's a surgical procedure in which a neurosurgeon uses a catheter to go through the groin or the radial artery to the brain to remove that clot that's causing the blockage in the artery. By removing it, they restore blood flow, and usually people start to have their symptoms resolve or become minimal. And this one is also time sensitive. It must be done within the first 24 hours of start of symptoms. So again, if they have symptoms at 8 a.m., it's 8 until 8 a.m. the next day that this can be offered. So delaying treatment or delaying coming into the hospital with symptoms could ultimately cause you to be unable to get one of these treatments. And then we also wanted to share what happens after a stroke. What could someone expect if they go to the hospital after a stroke? And if they come within a time window and they're candidates for treatment, they will get treatment. either the TPA and or the thrombectomy. But they'll also have imaging, which could be a CAT scan or MRI. And these are two machines that take pictures of your brain to help diagnose a stroke. The providers or doctors and providers will also do a workup, which means they'll look at, do different tests looking at your heart and your blood work to see what caused the stroke. And for this, they're looking at what risk factors does this person have that led to a stroke. And once we're able to identify the risk factors, they might start or change your medications to help manage those risk factors. So if a patient came in not knowing they had high blood pressure, they will be started on the medication to help manage that high blood pressure. When we talked about the symptoms, I mentioned how there might be weakness on one side of their body or their face. And so a patient may work with physical therapy, occupational therapy, or speech therapy in order to improve their recovery. Once a patient is discharged, they'll likely continue to work with therapy, and that can be at home or at an outpatient facility or inpatient, like a skilled nursing facility or acute rehab facility. And what they'll continue to do, even once they're discharged from the hospital, is follow up with their primary care provider and stroke doctors to ensure that we're managing risk factors and preventing future strokes from occurring. So some take-home points from our presentation. Many strokes are preventable. 80% of strokes are preventable. So talk to your healthcare provider about your specific risk factors and what you can do to prevent stroke. High blood pressure, which is the #1 cause of stroke, can be checked, lowered, and controlled. So talking to your healthcare provider about managing your blood pressure is going to significantly decrease your risk for stroke, as well as quitting smoking. Remember the BFAST acronym: balance, eyes, face, arms, speech, and time to call 911 if you see any of those symptoms. And time is brain. Calling 911 as soon as you recognize these symptoms will help to get the person evaluated sooner, and hopefully have treatments that decrease the effects of the stroke and improve their recovery. We've given a lot of information, but there's plenty of resources online as well. The American Heart Association has part of their website. If you go up there, you can click on stroke and they'll bring you to some of these resources where you can learn more about stroke. And your biggest resource is going to be your healthcare provider, because they will be able to give you specific information about what you can do to prevent your risk for stroke. Again, we're Stamp Out Stroke. If you are interested in us presenting at a community organization, please feel free to contact us. We provide our email, but you could also reach out to myself or Dr. Forman directly. Thank you, and now we'll open it up for questions.
Thank you all. I definitely learned some new stuff. So I really appreciate you all sharing. I have given people the ability to unmute. So if you do have questions, feel free to either raise your hand, wave at me, but you can also simply just unmute yourself and ask your question. Ranisha, can you put your phone number in the chat as well? I put your email address in there.
Yes, I'll put my phone number as well.
I mean, you guys could have been so thorough that people just, they don't have any questions, which, is also a good thing. Here's a question in the chat. What is a TIA? And if you had one, is it a sign you could have a stroke?
I can go ahead and answer that unless someone else wants to. A TIA is called a transient ischemic attack. And basically the way I think of it is I think of it as a warning stroke. So basically A stroke, as we said, is someone that has the blood clot that stays in there and prevents blood from getting past it. And it goes on to cause a stroke, which is physical damage you can see on the brain imaging. A TIA, I think of it as just as scary and severe, but it's the person gets lucky and that the clot will go away and it does not cause lasting damage. So someone with a TIA might have a full-blown stroke symptoms, but after maybe a few hours, it completely goes away. So while they got lucky, it's still just as significant. You need to still get to the hospital immediately because you're at a high risk for having another event soon. So you really want to go and get evaluated and get the full workup and get on the appropriate treatment. And was there a second part of the question?
I think you answered it.
Okay.
Because she asked, what's a TIA, and if you had one, is it a sign you could have a stroke?
Yeah.
Good. So Francine, thank you for that question. Michael has a question. Is there anything one can do for someone experiencing stroke symptoms until medical help arrives? Would aspirin or the like possibly help?
So we don't encourage people to take aspirin if they think they are having a stroke, simply because if you remember when Dr. Forman were talking about the two types of stroke, there's one that has the ischemic stroke, which is a clot, but there's also a hemorrhagic stroke, which is the bleeding stroke. And you often can't tell just from looking at symptoms if a patient is having a clot, an ischemic stroke, or a bleeding stroke. And aspirin can make the bleeding stroke worse. So the best thing to do, call 911. Don't give any medications. If you witness this, jotting down the time that this happened is helpful, because that allows the stroke providers to have an idea of when the symptoms started and if that person's going to be a candidate for treatment. So jotting down the time is helpful. If you live with this person, having grabbing the medications that they take could also be helpful. That will help the providers know if the patient's taking something that's a blood thinner. So those things would be helpful while you're waiting for EMS to come.
Right, thank you. Question from Randall. How often are people self-aware that they are having a stroke?
I think a lot of the times people know that they're having it. The problem is a lot of times they are not able to call for help. They might lose their ability to speak and understand suddenly. They might be so dizzy that they can't get themselves to a phone. They might lose vision where they can't get themselves to a phone. A lot of times people fall down because they can't move half of their body. So they can't communicate or physically get to another person. So unfortunately, sometimes people just aren't able to call for help if no one's around them. But a lot of the times people, are able to still call 911 on their own. Just I think educating your families and your friends about stroke so that, God forbid, if you were to have one, they would know what to do is the best thing.
And I would also add just being aware of the symptoms, because sometimes patients have like numbness in their arm or weakness in their leg, but they, instead of seeking treatment, they try to sleep it off or think that it will go away. So being aware and sharing the symptoms that we talked about, that BFAST acronym with family and friends, is helpful just so that they can recognize the symptoms and call 911 right away.
Thank you. Question from Althea. Can you explain the slide with 3 circles, the HDL, LDL, and tri? So I think you can still share your screen.
Yeah. Oh, are we talking about the video?
Oh, I don't know.
Maybe.
I think, in general, does anyone want to answer this before I go for it? Okay. Yeah, I mean, this is something that, I would encourage everyone to talk to their primary care providers about with the cholesterol. The one we really focus on as far as stroke, because of our clinical trials that look into this, is that bad cholesterol, the LDL. And we really like that bad cholesterol to be lowered. The HDL is considered to be a good cholesterol, so that one is obviously okay to be higher. And then the triglycerides are another thing that we would like to be low. I won't get into like the, physiology of what each of those things entail, but essentially they're just the cholesterol, the liver makes it and it circulates in the blood. And we want them to be well controlled, which often can be done with diet, but if not, then we have a lot of medications that your primary care provider can discuss with you.
Right. Thanks for the question, Althea. Are there any other questions? I don't see any hands raised. Oh, Ms. Shaw, come on in.
As part of Althea's question on that cholesterol, I have high LDL and high HDL. And so I used to say, well, gee, can't the HDL, just offset the, the LDL? And he says, no, I'm putting you on medication. What? Oh, this is something that does happen. I want to know why. Why are both of them high?
So a lot plays into our cholesterol levels. It's not only our lifestyle, right? It can also be genetic. Your provider will know more specifically for your case, but in general, it can be not only the foods that we're eating and how much we exercise, but a part of it is genetic. And some people just have higher levels than others or lower level than others, depending on that person.
Yeah, I just thought it was strange. And yes, I do exercise. So. Okay, thanks. He couldn't answer it either, but.
Michelle. Well, I think those were all the questions. I encourage you all to reach out to the team through the email address, which was shared in the chat, or you can give Ranisha a call on her cell. Michael says, a great presentation, many thanks. I agree. So a big round of applause for all of the presenters. I know some of you are still eating your breakfast, so you're not on screen to clap, but I'm clapping for you. So thank you all so much for joining us, especially our speakers this morning. I encourage you to follow up. They are ready, willing, and eager to present at your local community groups, events, etc. So please contact Ranisha to set that up. Enjoy March, and I hope to see you at our April breakfast. Thank you. Bye-bye.
Thank you all.
So much.